I think it's about time we got started. Thank you so much for joining us today for our Planning Ahead webinar. I'm Sarah and I'm the nurse at Compassion in Dying, and I'll be co-hosting today with Jen.
Hi, I'm Jen and I manage our content and information services at Compassion in Dying.
But we've got lots of information that we want to cover in the next hour, so we'll run through it quite quickly. But there is a facility, a Q&A function for you to submit questions. It might be that some of those can be answered along the way, but if they're a bit more complex, we'll wait to the end and try and get through some of those between me and Jen. But if I don't get to those questions, because there might be quite a few, please do include your contact details, like your email, with your question, and I will get back to you in the next few days. All right. So, at Compassion in Dying, our vision is a world where individuals are placed at the centre of their care. So we strongly believe that everyone should be given information and support needed to make decisions about their treatment and help to plan ahead to ensure their wishes are known about and then can be followed. And I'm really proud to say that since we began in 2007, we've supported well over 70,000 people now to plan ahead for their treatment and care. And we provide this support to people in a number of ways. The core services we have are our nurse-led information line. So we speak to people who are well, unwell, family members, lots of relatives get in touch with us, lots of healthcare professionals too, and other organisations. So a lot of the charity sector do signpost to one another. We also have a peer navigator service, a lovely colleague of mine, Hina. She supports people living with a new diagnosis or a long-term condition or illness, as she does. She helps them to come to terms with their condition and plan for appointments and talk to relatives and doctors about their preferences for treatment. We also have a range of publications and we're the leading provider of Advance Decisions in the UK. And lastly, we also have an online My Decisions website, which allows you to make an advance decision or an advance statement for free online. So we know from our work at Compassion in Dying that in order for people to have the death that's right for them, they need to be involved in decisions about their treatment and care. But sadly, nowhere near enough people are recording their preferences, which can lead to some really sad and very stressful situations, at the point at which we often speak to people. So whilst 82% of people report having strong views about their end-of-life treatment, only 4% of people are putting this in writing. There's clearly a really worrying disconnect here. I think this next slide now goes some way towards explaining that. So one of the most significant barriers stopping people from planning ahead is that they wrongly believe that family members will be able to make decisions when they no longer can. So I think if there's one takeaway from today, hopefully there'll be loads more, but if there's one takeaway, something to really try and remember is that if you're next of kin, so if you've been married for 50 years, if you have been looking after your frail or elderly parents and living with them at home, no matter what your relationship, you have no decision-making authority just because you're next of kin. So healthcare professionals should certainly involve you or involve loved ones in decision-making, but the final decision will come down to them. So there'll be loads of other barriers stopping people from planning ahead. That's not the only problem. People don't think about it. They don't know that it's free. They think they need to use a solicitor. I'm going to talk about solicitors a bit more later. And they don't know where to go for support. But what we know, and I hope this comes across loud and clear today, is that planning ahead for a time when you lose capacity is incredibly important, because if you lose capacity in the future, you won't be able to tell people what you do and do not want to happen to you. But when people plan, they report feeling a sense of peace of mind. So people feel really relieved when they've got this planning in place. But on a practical level, on a practical basis, people are less likely to have unwanted treatments as a result. They're less likely to have crisis care or emergency admissions. And everyone is clear about what they do and do not want. And that reduces confusion and ambiguity and conflict. So drawing on my experience working clinically in the NHS as a nurse and looking after people who are approaching the end of life, family conflict and people disagreeing is really common, and it's very, very difficult to navigate. So you can have lots of relatives all coming at you with very different opinions about what should happen or what this person would have wanted. And how, as a healthcare professional, you're supposed to navigate that situation? Well, it's very, very difficult. I can tell you, it's really, really hard. So I've seen it on the flip side, how difficult that is. And what I would say is that if you plan ahead, not only are you ensuring your wishes and your preferences remain at the centre of all care, you're actually making life easier for family, everyone's clear, and also healthcare professionals. So it makes everything easier. And that's a really important point that a lot of people who get in contact with us say. People say all the time to us, I want to make sure that everybody's clear. This is a way of doing that. I've got some quotes here from people who've been in touch with us explaining why it was important to them to plan ahead. I'm going to read that top left one. I'm concerned about not being allowed to die when the time comes. I'm frightened of losing control. Control is a really consistent theme that comes up for people that get in touch with us on the information line at Compassion in Dying. Many people really fear losing control, and I think if you're attending this webinar, that may resonate with you. And this is why the Mental Capacity Act, which underpins all of the work that we do at Compassion in Dying, is such an empowering piece of legislation in England and Wales. It allows you to plan for a time when you can no longer make decisions about your treatment and care, and that then allows you to remain in control. So control is important to you, if independence is important to you, that's something really important to bear in mind. So through our services, we support people to plan for appointments, which involves asking the right questions to get the information they need. And you'd be surprised at just how many people don't have enough information about their diagnosis or their condition, or about a loved one's diagnosis or condition. And without that, how can they possibly make an informed decision? So it really helps people just to have the opportunity to talk things through. We also support people to think about their priorities. And again, I think drawing on my experience clinically, when talking to people, when helping people in clinical care, I rarely have the time to really listen to people and talk about what it is they really wanted. It's just, you've always got 100 other things you need to do, and it's very difficult on a busy ward to stop and really listen. And a caller recently said to me, I've heard nothing but what people can do for me, but what no one's done is actually listen to what I want. And I'm really proud that that's an amazing part of our service. It's a luxury. I know that as a clinician, that we're able to provide that, and it's really worthwhile. People really value that opportunity to explore what it is they want. And from then they can go on to talk about what they want there, about what's important to them about their health and end of life with family and friends. And all of this is really valuable, but it's so important from this point to then take the next step and formalise your wishes and put them in writing. So I'm going to now talk through the pre-planning ahead tools and the way we support people to complete these. So the first document I'm going to talk about is the Advance Decision form. So an Advance Decision is a form which lets you refuse any medical treatment you do not want to be given in the future. So it's also known as a living will or an advance directive. That is quite confusing. The terms are used interchangeably, but they all mean the same thing. They're not separate forms. I'll use the term Advance Decision. That's how it's referred to in the Mental Capacity Act. That's what I'll call it moving forward. So an Advance Decision form is legally binding in England and Wales, which means if the situation outlined in the form arises, it must be followed. So it's an equivalent to an adult with capacity refusing a treatment. And this is something that people do get a bit stuck on when completing these forms. So I'm going to try and make this really clear. You complete this form when you have capacity. So now you write the form when you're either well or if you're newly diagnosed, when you're able to make decisions. You complete this document. But it's only then used if you lose the ability to make decisions for yourself. So it's ready, waiting for that time. So when you complete this form, some people will go to the GP and submit it, and sadly they'll say, oh, does that mean you don't want any antibiotics ever again? That's not what it means. And sadly, there is a little bit of misunderstanding out there. So it's really important that you're clear on that. And when we provide these forms, there is support and guidance for GPs included. So that helps if there are any kind of ambiguities or confusion there, you can sort of use that to help them understand a little bit better. Advance decision forms aren't legally binding in Scotland and Northern Ireland, but they are usually recognised and followed by healthcare professionals the same way as they would be in England and Wales. So don't be put off if you live in those areas, those places, just because they're not legally binding. If you feel strongly about refusing treatment, it's still a really worthwhile document to complete. So, to be valid, an advance decision must be completed by an adult with capacity. It must be in writing. It must specify the treatments that are being refused and the situations they're being refused in. They must include a very important phrase: this refusal is to apply even if my life is at risk or may be shortened as a result. And it must be signed in the presence of a witness who then also signs the form. I've got a picture here. That image is our form, the hard copy version that we send in the post for people who don't like doing things online. And people can complete their own. Like, you don't need to use ours. But what makes using ours easier is that we created this form in collaboration with the public, healthcare professionals and legal professionals, and it's got all those required components to make it legally binding. So you don't have to remember to make sure that phrase is included and so on. It's all there. There's a space for you to sign and the witness to sign. So it's sort of set up and ready to go. But as I said, if people write their own, I'm more than happy, and we do check those and look those over. So that's no problem. So, as I mentioned, we created our form in collaboration with legal and healthcare professionals, but most importantly, we also work with the public to best meet user needs. And this is how we developed situations that we list in our form, the situations people want to refuse treatment in. So dementia is a condition. It's the leading cause of death in this country, and a lot of people want to refuse life-sustaining treatment if they have an advanced dementia. Another condition that comes up is brain injury. That's included in our form, so head injuries or stroke, and then diseases of the central nervous system, motor neuron disease, and then terminal illness. The form is designed, our form, is designed so that you can choose to include refusals in these situations if you wish to, but then there's a free text space if you want to write your own refusals. So you can either tick some or none, or you can write your own. The whole point is this isn't supposed to be a prescriptive form. We're not trying to encourage people to refuse things they don't want to refuse. The option is there, but it's got to reflect what the person who's completing the form wants it to. And if anyone's not sure, we encourage them to call us. I'm going to keep saying this all the way through. Please call us and we can talk through what it is you want to refuse and help you word that. As I mentioned before, all refusals have to be very clear and very specific, both with regards to what's being refused and when. So when people add their own refusals or write their own, it can be a good idea to run that through with one of us to make sure that it's clearly written enough to be legally binding and then can be followed. Right, so the most common treatments people want to refuse are life-sustaining treatments. So this can include CPR. This comes up a lot, as I'm sure you can imagine. The CPR is cardiopulmonary resuscitation. That's all efforts to restart your heart and breathing. But there's so much more life-sustaining treatments for CPR, and others include mechanical ventilation, so both invasive and non-invasive. This came up a lot in the past year over the pandemic. So lots of people didn't want to escalate their treatment if they got coronavirus really badly and needed hospital care. A lot of that was the fear of, I suppose, being in hospital and separated from family and perhaps dying alone. So lots of people wanted to refuse that treatment. Another common life-sustaining treatment is clinically assisted nutrition and hydration. So I mentioned the conditions before, like dementia, and actually that's an illness that quite often when people lose the ability to swallow will then go on to need clinically assisted nutrition in the latter stages, and lots of people don't want that. So that's a good example of when this sort of treatment is refused. And then antibiotics. So it's not a refusal of all antibiotics. The way it's written in our form, it's a refusal of antibiotics for life-threatening infections. So again, thinking back to that GP scenario I mentioned earlier, if anyone questions this, it's about being clear that this only applies if you've lost the ability to make decisions, one of those previous scenarios has occurred, so you've got dementia, and then you require antibiotics for a life-threatening infection. So it's not a refusal of all antibiotics from this point onwards. I hope that's clear, but if it's not, you're very welcome to get in touch with me and I can explain it more. So, when it comes to making an advanced decision, they're free, there's no cost. We provide these forms and they come with clear guidance. We support people on the phone and we can email them, and we can support you over email to make sure, as I said before, the form reflects what you want it to. They're legally binding and you do not need to use a solicitor. Again, this is a really important take home. It doesn't make your form more valid or more legally binding or extra special if you use a solicitor, and I'm afraid I would say, in fact, quite the opposite. In the last few years, I have checked and seen a lot of advanced decisions that are written by solicitors, and they are not clear. I'm a clinician and I do this as a profession, and I wouldn't know what the instruction is in these forms a lot of the time. They are so unclear. They're written in complicated Old English, and often they don't even have the required components to be legally binding. I'm sure there are some good ones out there, but to pay for that service is a shame, especially when we do this for free. So I hope that's clear. Solicitor isn't required. And these forms only apply if you don't have the capacity to make the decision for yourself. So some of you might have heard of a Do Not Attempt Resuscitation form, or DNA CPR. I think it's important that I just clarify the difference between a DNAR form and an advanced decision. Because people call up, ask me for these, and it actually materialises when I speak to them that this isn't really the form they want, or they don't understand it very well. So hopefully this is a clear explanation. A DNR is completed by a doctor or a specialist nurse, and it's a communication tool from one healthcare professional to others that CPR shouldn't be attempted. So it only relates to CPR. It doesn't cover any other treatment, and it's not legally binding. So it's a really useful document. It's very clear. They're very well recognised by healthcare professionals, and that's mainly because they only relate to one treatment. Whereas an advanced decision is written by you. It can refuse any medical treatment, and it's legally binding. I think the important difference here is what we're focusing on today is person-led documents, what you can complete for yourself. A DNAR form has to be completed by a clinician. You can't do these for yourself. And it's absolutely fine to have both of these in place. But if you go to a GP and ask for one, or a doctor, and they don't give you one because they don't have to, it's at least, I suppose, a comforting backup to know that you can refuse CPR in every situation if you wish to, in an advanced decision. And again, we can help you to do that. So I'm going to finish my section talking about someone who has been in touch with us last year. And it's a nice example of how planning ahead supports people to have the end of life that's right for them. So this lady, Mary, was in touch a number of times, and she was helping her husband to get ready for his end of life. He had a terminal condition, and he knew that he didn't want to be admitted to hospital as his condition worsened. He wanted to be kept comfortable and supported to die at home. And planning ahead, getting these documents in place and ensuring he was set up sufficiently so that they had pain relief and district nurses and so on there to support them meant that that was possible. Not everyone wants to die at home. I'm really, really aware that dying at home is not the determinant of a good death, but for this individual it really was, and by planning ahead they were supported to achieve that. I'm going to move, I'll pass you over to Jen now, who's going to talk about advanced statements.
Lovely, thanks Sarah. So Sarah's just giving us a really good overview of advanced decisions which are used to refuse treatment, and I'm going to talk a little bit about advanced statements. And they're used to say what care you do want. And they're actually a really good way for you to start thinking about what's important to you and your quality of life. And it's really interesting because the term quality of life is kind of bandied around a lot as a universal concept, but actually it's very individual, it's very different to everybody. And by completing an advance statement, it will give you the opportunity to work through actually what it means for you. It is also a really good way to start planning for the end of life. So if you have been wanting to bring this up with any relatives or friends to encourage them to plan, we find that advance statements are a really nice, easy and soft way into thinking about your priorities. So the advance statement, similar to the advance decision, only comes into play if you've lost capacity to make decisions for yourself. So you complete it now while you are well and able to do so. It's not legally binding, but everything within it does need to be taken into account by the healthcare professionals caring for you. And so it's a really, really helpful guide for them when making decisions in your best interests. And the reason it's so important is because many people will lose mental capacity at some point towards the end of life. For example, some people with advanced dementia do live for several years while needing quite in-depth support and care. And in situations like this, an advance statement is key because it is all of the information that your relatives and nurses and carers and doctors need to know about you to give you the care that you would want. And like Sarah has highlighted already, what this does is it keeps you in control. So control is so important for people. And by making your advance statement and writing everything down, you will be able to define what your end of life looks like. So thinking about all of the things that you can include, it's absolutely up to you, but it's important that you include anything that people need to know about you if you couldn't tell them, and how they would affect decisions about your treatment and care. So this can include things like how you spend your time, hobbies, activities, but also what makes you happy and what gives your life meaning. Anything that's important to your identity, and that's the little things that people need to know, like what name do you like to be called, and what clothes do you like to wear, your values and religious or spiritual beliefs. How you really celebrate your faith is very independent to people, so it's important to get that down, both how you do it day to day, but also the important dates or important times of year for you. Important people in your life, this is a huge one for people we speak to. It's not obvious who is important to you, so it's really important to get that written down, who you like seeing, what you like doing with them, how long you like to spend with them. Any lifestyle or habits that people should know. Again, this is the little things of your daily routine that people might not know about you. So what time do you like to get up, and do you like an early night? Food is obviously very important to everybody, especially at the end of life when it's maybe one of the things that you can still enjoy. So if there's a particular diet you follow, or anything that you really don't like or allergic to, or just makes you feel really unwell. Where you want to live at the end of life and be cared for and die is something that people put a lot of thought into. Some people have a really good idea, and if so, you should detail that in your advance statement. Sarah's mentioned dying at home, but lots of people actually have hospices that are close to them that they've always known or supported, or a local care home. And then information about your health. And that's really helpful if you are living with multiple conditions, how you manage those day to day, and the little things that you do to make sure that you're feeling well, that other people just might not know if you haven't told them. So our advance statement form, similar to our advance decision form, was created in collaboration with members of the public, and also with huge thanks to St Joseph's Hospice. We went through and asked individuals kind of what were the things that they were including, but we also spoke to the care staff and nurses there to find out what is it that people actually need to know on a caring basis to make sure that they can look after people well. Our form is completely free. And obviously you don't need to use a solicitor at all, and it comes with all of these helpful prompts throughout the form to get you to think about what you might want to include, but obviously it's completely up to you, so you should write whatever is right for you. The form will only kick in when you lose capacity to make decisions for yourself, and it actually works really well alongside an advance decision and also a lasting power of attorney, which I'm going to come on to next. So this is Jo. We supported her last year, and I think she's really interesting because she does live with multiple conditions, And she told us this, which is, I have multiple conditions and have to structure my day around my medications, but also how I'm feeling. Until I started writing my advance statement, I hadn't realised how much someone would need to know to look after me well. It's a huge relief to know it's all written down somewhere now. So for someone like Jo, who didn't really realise how many of the things that were inside her own head until she started going, and I feel like most people have a similar experience when they start making their advance statement. So that's advanced decisions and advanced statements, and they're both documents that you can write which record your wishes very clearly in writing. And that is different to making a lasting power of attorney. So a lasting power of attorney is a legal way to give someone you trust the power to make decisions for you if you lose capacity to make decisions for yourself. And there's two types. So one is health and welfare. So that's anything to do with your treatment and care. And one is finance. So that's anything to do with your property and money. You can make both, and if you do make both, you have to complete separate forms. But today I'm just going to talk about the lasting power of attorney for health. And coming back to the point that Sarah raised earlier about next of kin, often we think that our next of kin can make decisions for us, and that's not actually true. So they should be consulted by your doctors and care team, but if you haven't made a lasting power of attorney, your doctors will make the final decisions about treatment, and that would include things like life-sustaining treatment. So if you do have someone that you trust, that you want to give those rights to, when you make them your lasting power of attorney, they'll be able to make any decisions about your treatment and care. So it's really, really broad and really important to know. So that could be anything like where you live, where you're cared for, and where you end up dying, your daily routine and diet, what you do with your time, medical care and treatments, including life-sustaining treatment, but also access to people. So who can visit you and who you spend time with. And they're all really, really important things. And because of that very powerful position that attorney is, you need to make sure that you pick the right person. So you need to pick someone who knows you really well and that you trust to respect your wishes. They must understand that this is a really big responsibility, and that they may need to be around daily, or they may need to support you for months and years at the end of life. And another really important point is that you need to pick someone who's going to be able to stand up for you and advocate on your behalf, because there may be a lot of different people involved with your treatment and care at the end of life, and your attorney is there to act as your advocate and make sure that your wishes are followed. So given all of that power, it's really important to think who would be the right person for you. We get calls a lot from people who say, you know, well, I have 4 children, and so I really should use all 4 to be my attorneys because otherwise it might cause problems. But actually, if you think that there could be potentially conflict between those 4 children, for example, then actually you're setting them and yourself up to fail. So don't feel obligated. Don't choose the people just because they're closest to you. Choose the people that fill the criteria of that you trust and can advocate for you and are around. Also, after thinking all about all of that, if you don't have someone who you're really close to, or you don't have someone that fits that bill, that's absolutely fine. You shouldn't make a lasting power of attorney unless you have that person or people that you trust. And that's why there's these other great documents like advanced decisions and advanced statements that you can complete to record your wishes. So don't feel like you need to make one. So for making a lasting power of attorney, you can complete the form by hand or you can complete it online. The forms come from the Office of the Public Guardian, which is a government funded body, and they're the ones that register the forms. For each form, you need to pay £82 to register, and that's for the health and welfare and the finance, so it's £82 for each. You really don't need to use a solicitor. So many people we speak to, unfortunately, have either started with a solicitor or use a solicitor and were charged kind of thousands of pounds to do the process. The form comes with really good guidance to guide you through how to complete it and how to sign it. And then also we're there at the end of the phone if you have any questions along the way. It can take up to 10 weeks to register. So just bear that in mind. It's another good reason to get on with planning now, getting things in place while you can. It is legally binding, which means once it's been registered, your attorney can make any decisions about your treatment and care, but only once you've lost capacity to make those decisions. So that's really important to remember. So this is a quote from Alan about his mum, and it kind of is unfortunately in comparison to a lot of calls that we get about people who are looking after loved ones who haven't planned ahead, and we are supporting them to try and be involved in decisions. So we support them to kind of talk to doctors and try and influence, but they do have a very difficult situation where they don't have the legal right to make decisions, and that can be really difficult watching a doctor make big decisions about your loved one's care. So luckily for Alan, that wasn't the case. His mum was diagnosed with dementia and was very proactive right from the start and got going on planning now while she had capacity. And making Alan her lasting power of attorney meant that she knew from then on he'd always be able to look after her even after she lost capacity. So that's a really quick summary, really, of the 3 ways that you can plan. But we often get asked, can I make all 3? Do I have to do all 3? The answer is you can absolutely do all of them, but you should only do the ones that are right for you. So you can, but you don't have to. But if you do all 3, then they do reinforce each other really well. It's kind of like a belts and braces of planning ahead. And there's a few reasons for that. So having an advance decision and advance statement in place, if you do make a lasting power of attorney, means that your attorney will have your wishes written down in writing, and that makes things much easier for them. We're constantly told by attorneys, you know, I knew my responsibilities when I took it on, and I was really keen to help mum, but actually when I got to the hospital and it was quite a big decision about withdrawing treatment, it was quite difficult, but I had her wishes written down in writing, and therefore I knew, I was reminded and put at ease that I was doing what she wanted. So it's really helpful for attorneys to have guidance written down, even though obviously you'll be talking to them as well. The other important part the advance decision and advance statements play is that your attorney can be challenged if a doctor thinks you're not making decisions in the best interests of the person. They can challenge that. And so to have written evidence of someone wanting to refuse treatment or someone wanting to live in a certain place is incredibly important, because with that evidence they can prove that they're acting in your best interests. An advance decision only refuses medical treatment. So some of us might be in situations where treatment will be refused, but a lot of us will probably be living for quite a long time with fluctuating capacity or no capacity. And that's where the advance statement really comes into play, because it's talking about everything you do want to happen to you. And then it's always good to think about having all of them as a backup. So if anything happens to your attorney, for example, if unfortunately they die, then you would have your advance decision and advance statement as backup for your planning, and vice versa. So Sarah talked about beginning with talking at the beginning to family and friends, and then writing all your wishes down. And then there is a third step, which is probably just as important, and that is sharing your forms. So once you've completed them, you'll need to share them really widely, and that's because they won't be automatically added to your NHS records, and we don't hold copies of them. And without sharing them widely, people won't know they exist, which will be a huge problem for you. So we often recommend that you share a copy with anyone who is close to you. So that might be relatives, that might be close friends, anyone that might be called to the hospital, for example, in an emergency. Making sure that a copy is added to your medical records. And you can do that by visiting your GP surgery. And then for your advance decision specifically, it's a good idea to also contact your local hospital and your local ambulance trust. An advance decision might be needed in an emergency, and they will be able to hold a copy of your advance decision. For example, if you're admitted after hours and they couldn't get in touch with your GP surgery, then they'd have a copy there for you. And when you're sharing these forms, often people might have questions for you. So it's a really good idea to be ready for that. Be ready to talk about what you want, why you've planned ahead and why you're sharing the forms with them, and be ready to answer their questions if you can. And some tips for that are just to make sure that you're really clear about what you want, what you've written in your forms, so that if they do ask questions, you can answer them clearly. Find the right time for relatives and close friends, so don't spring it on them. Kind of make sure that you have time and you're relaxed. As well as that, sometimes it's helpful to give people warning. So you've gone through this wonderful process of writing down everything that you do want to happen, and you're feeling now very prepared, but they might have no idea. So if you give them the time to prepare as well, then it can often be a better conversation. Take your time and be patient. Sometimes these conversations can be challenging for people, but they're so worth having. You might need to stop the conversation and come back to it. Just make sure you come back to it. And then lastly, remember it's okay if people disagree with what you want. So everyone's end of life wishes are individual to them. And the most important thing is that you're being true to yourself and making the decisions that you need to. But that's not to say that they have to agree with them or that they would make those decisions for themselves. So just be aware that people might have their own thoughts about it. For anyone that's living with a long-term condition or has a new diagnosis, if you need any support around talking to your family or friends or relatives or doctors about that, then we do have a peer support service available, and Hina, our peer support, can support you to talk to your family, friends, doctors about what your priorities are, help you think through what your new life is like living with your new diagnosis, and then also support you to plan ahead as well. So that's everything to do with the 3 planning ahead documents, and I hope it's been a helpful start for you. We're actually now going to go over to some questions from the Q&A, I think, Sarah, and see what we can do to help.
Thank you so much, Jen. We have got quite a few questions. As I said before, we're not going to be able to get through all of them, but we're going to try and get through as many as we can. So the first one I've got here is, can you use an advance decision to request a treatment? And in short, no. An advance decision is just used for refusing treatment. You can outline in your advance statement if there's a treatment that you would like to be offered. And in our form, there is a statement that says, to avoid all doubt, I wish to be given all treatment aimed at keeping me comfortable. So I hope that's answered your question, but no adult, whether you've got capacity or not, can demand a treatment. But you can certainly outline your preferences in the statement. Okay.
Right.
It's a great question, though. I've got another question here. So I completed my advance decision in 2013. Have there been any legal changes since then, requiring specific wording, which mean I should complete a new one?
That's a good question.
Yeah, it is. Do you want to go for that, Jen?
Yeah, sure. So the quick answer is no. There's been no legal changes. Mental Capacity Act still stands since 2007. However, what we do recommend is that you review your advance decision and advance statement regularly, and that's every 2 years or sooner if your health and wishes have changed. And the reason behind that is it's really good to remind yourself of where the documents are and what the documents say, and make sure that they are still in line with your wishes and that nothing's changed. Things do change for people, and it's really good to review them regularly and update them when you can. It's also really helpful for doctors and nurses and carers to know that your advance decision is up to date. It gives them great confidence knowing that you've reviewed it regularly and that it will definitely reflect your current wishes.
Lovely, thank you, Jen. There's another one here, a really good one. How can you be sure that the advance decision form is with you when you go to hospital, or can it be held digitally somewhere central? I've heard ambulance drivers can't find the form when needed.
Another great question.
Yeah, I'm sure we both want to launch into that. I'll start, but I'm sure, Jen, I'm going to miss things. So obviously jump in. At this point, we can be really conversational and we can both chip in. So the sharing of the form, and Jen did cover this a little bit, is really, really important. So once you've completed an advance decision, photocopies are as valid as the original document and can be shared as widely as possible. And we've got lots of support and guidance on the places you can share that. I would say that it's really important to have a photocopy at home with you, and some people even carry a copy when they're out and about if it's really important to them, or if they're really unwell, because there's a higher chance that they will have I don't know, become very unwell in the community or something. Some people have the Lions Club bottle in the fridge system that can work really well as well. So at home you can have a bottle in the fridge and a symbol for your front door. So if anyone comes to your house, they see the symbol and they know there's important health information in your fridge. So that works for some people in the home. But also, as Jen mentioned, you can share it with your local ambulance service. And you can also share it with your GP and close family and friends. Jen, have you got anything more to add to that? I'm sure there's loads I've missed.
No, I think you've covered most things. We also provide a notice of advance decision card at Compassion in Dying, which you can keep in your wallet, which says the name and contact details of someone that has a copy of your advance decision. Most local areas have some sort of NHS system which you can upload your advance decision to. So it's really important to visit your GP and ask them how can they make sure that it's added to your medical records there.
Thank you, Jen. I've got another good one for you, Jen. I'm going to pass on to you. My advance decision was witnessed by my father, who will probably die before me. Is this a problem?
Oh, it's a great question. So no, it's absolutely not a problem. Your witness is witnessing at the time that you are the person making the advance decision. So once they've signed and dated it, their job is over. So absolutely, it's fine if your witness does pass away. The other maybe interesting question to hear is anyone can be your witness. So lots of people often think their witness has to be a doctor or a solicitor or a legal professional, and that's not the case. So your witness can be anyone. It can be a close family relative, it can be your spouse. It's best to get someone who is potentially a third party if possible, so a neighbour or a good friend. But if you only have a few people in your life and they are all your close family members, that's absolutely fine. Your witness can be one of them.
Thank you, Jan. Right, so there's a few lasting power of attorney questions. Can attorneys be more than one? Can you have more than one attorney? Yes, you can. You can have quite a few attorneys. Jen's a really good power of attorney person. I'm going to pass it on to her again.
You can indeed have more than one. Often it's helpful to have more than one, because obviously if something happens to your single attorney, then your lasting power of attorney would be void. So it is helpful to have at least two. Potentially more than 3 or 4 could be quite complicated, because obviously they might not all be able to come together. So you should appoint whoever you want, but yeah, 1 or 2 is great. You can also have replacement attorneys, and that means that if your original attorneys are no longer able to act, if they die, for example, then your replacement attorneys step in. And that's a really helpful way to give the attorneys different rights. So if you would like one person to be able to make decisions for you, but if they weren't able to, then another person, then you would use the replacement attorney.
Thank you, Jen. And sort of building on from that, another question we had was, what happens if you have several people or several attorneys? How are decisions made? So Jen, I'm sorry to keep directing them to you, but you're probably on the flow now with LPA questions.
That's fine, no problem. Unfortunately, the Office of the Public Guardian and the Mental Capacity Act gave the names of these terms very silly names, but you can choose how your attorneys have to make decisions. So you can decide if they have to make decisions all together. So that's jointly, and that means that they all have to agree, they all have to be unanimous. You can choose if they can make decisions jointly and severally, which means they can either make decisions on their own or they can make decisions all together. And making decisions jointly does mean that everyone has to obviously agree and be there. Making decisions jointly and severally means that if one of your attorneys isn't available, your other attorney can act for you. So it's a bit more flexible, that option. But these are decisions that you will go through as you complete the form, and each section is laid out very clearly to explain it. But if you would like to talk it through at any point, do give us a call.
Got a theme running, Jen, so I'm going to ask you one more question about LPAs.
Sure.
What if my attorney dies?
Yes, so if they are your only attorney, then I'm afraid that your lasting power of attorney would then be void and you'd have to start again. If you had appointed more than one attorney and you had appointed them to make decisions separately and together, your other attorneys can still act. But if you appointed more than one attorney and you appointed them to make decisions all together, so they had to be unanimous, again, it would be void. So that's the other reason that appointing jointly and separately gives you more flexibility.
Brilliant, thank you so much, Jen. So I've got a question here and I'm going to answer it because I've just defaulted to you enough now. Can I build an advance statement into an advance decision form? And if I do, does it effectively make it legally binding? This is a really interesting question because, and the answer is no, but I'm going to explain that. So in our form, our advance decision form template, we include a space where you can write an advance statement after the refusal. And it's just helpful to have this documentation together. If people want to do an advance decision, often they do want to have a statement as well, and vice versa. So it's helpful to have them together. I would say the statement really then gives the advance decision some extra context, but the advance statement, whether it's separate to the advance decision or completed on that same form, is not legally binding. Okay.
But your advanced decision section would remain legally binding.
Always,
so you can combine the forms. Yeah.
Lovely. So, going on to some more questions. Is the DNA CPR unified throughout England now? At one point, it was only applicable if the hospital that implemented the DNA CPR was within the catchment area. So Jane,
Yes,
you're very good at portability.
I'm afraid that is still the case. So DNR forms differ all over the UK. There'll be different forms, sometimes within one area for hospitals and for community care. So it's really important that you find out what DNR form you need in your area and what will be respected by your ambulance trust. And you can do that by contacting your local ambulance trust. And if you're not sure how to do that, then we can do that for you. Lovely.
Another really good question is, can I change my mind? And yes, absolutely. If you write an advance decision or an advance statement and then you change your mind and either want to change the refusals or just rescind the form entirely, that's absolutely fine. You can do that at any point whilst you still have capacity. You just need to remember, if you've shared the form widely, where you've shared that form, and then either ask them to destroy it or collect those so that no one continues to hold the form. Okay, anything to add to that, Jen?
If you change your mind about your lasting power of attorney, you just need to get in contact with the Office of the Public Guardian and begin the process of cancelling that form.
Lovely. I've got some questions about on capacity here. So how is the moment of capacity loss decided? If somebody is very confused but has not been told that they lack mental capacity, could they still sign an advance decision document and would it be valid? That is a really good question. So as we've said, you have to have capacity to complete an advance decision. Capacity should be assumed unless it's proven otherwise that you don't have it. So it is tricky, and if they strongly feel that you didn't have capacity when completing the form, they could override it. But that would be quite difficult. I mean, it would be case-by-case basis. It'd be very difficult to know from one person to the next if that was the case. Have you got anything to add to that, Jen?
Yeah, I'd say if you're worried about your capacity being questioned, on the front of our form at the bottom of the first page, we have a section which is I've discussed this advanced decision with. And the reason that's there is so that you can discuss your advanced decision if you want to with your doctor, and they can say that they have been through the form with you and sign the form there. So for example, people who have just had a recent diagnosis of dementia, you absolutely might still have capacity, but because you have that diagnosis are worried that you might be doubted in the future. So you can do things to make sure that you show that you had capacity at the time of making the form. I'd also just add that it's very, very uncommon. In fact, I've never heard of someone making an advanced decision while they were very confused. While our form is very straightforward and we provide support, it's not something that you could do if you had really fluctuating capacity. It does take concentration. So it's not something that people can kind of stumble into accidentally.
Lovely, thank you. There was a question as well, someone asking what's clinically assisted feeding. So clinically assisted nutrition is when you can no longer eat and you are tube fed. So typically you might see a tube that goes through your nose into your stomach called a nasogastric tube, and some people on a more long-term basis would have what's referred to as a PEG, which is a tube that's surgically inserted into your stomach, like sort of through your abdomen. Yeah, so that's what that is. I hope that's answered the question, but again, if it's not clear or you want to talk these things through, feel free to get in touch. And then I've got one more question here. Is it true, even if you have capacity, your lasting power of attorney can still make decisions for you? Not for health, no. Attorneys, lasting power of attorney for health and welfare, they can only make decisions if you can't make that decision for yourself. And it might be that you can make some decisions and not others, so it depends on the decisions, but they can only step in if you're no longer able to make that decision. It's a bit different with finance, which is why this is confusing. So we're not really talking about finance today, but the way that works is different, and attorneys can make decisions for you when you still have capacity. For the finance form only, it does work very differently.
Yeah, so if you complete the finance form, you can stipulate when they're allowed to make decisions. And the reason that you're allowed to make decisions and act on your behalf, really, while you have capacity for finance is more for practical reasons. So if you're in hospital, for example, and you have full capacity, but you need someone to access your bank accounts and pay your bills. So that's why they're set up slightly differently. Whereas the lasting power of attorney for health and welfare only kicks in if you lack capacity.
Okay. So I do have one more question. Have we got time? I think we've just got a few more minutes.
We can do one more question, yeah. Yeah,
lovely. Is there a specific symbol for your front door to indicate medical info is in the fridge? So I mentioned the Lions Club, and I was going to ask, I'm going to put my colleagues who are working hard in the background, to ask them to actually put a link, if they can, for the Lions Club into the chat box so you can see. But the Lions Club, they provide these bottles and the stickers or the symbols for free. I think it's like a kind of green cross, but that would be sent to you as part of the package. So if you, at some point in the next few minutes, hopefully will see the link that will give you the details of how to get one of those sent for you for free. Okay.
And what you'll receive is a little pot that goes in the fridge, and then you put the sticker on your front door, and paramedics are trained to notice the sticker on your front door as they arrive, and then they go and check your fridge for your important documents. There's more information also about Lions Club International and all the other ways that you can make sure your wishes are known on our website and also in our Planning Ahead booklet. So please feel free to download that from the website, or we can send paper copies out, and the same for our forms. So I think we'll stop questions there, Sarah. I just want to thank everyone for coming along today. I hope that you have found this kind of very beginner information helpful. I guess the next step really is for you to have a think about what matters to you, and think about which of the documents would be right for you. And sometimes that takes a bit of thought, and sometimes it takes a conversation. So do get in touch if you need some support with that. Then it's time to get going with recording your wishes, making the plans, getting them down in writing, and then making photocopies and sharing those with your family, friends and healthcare professionals, and having conversations with them about end-of-life care. And then obviously contact us if you need any support along the way. So that is everything from us. Thank you so much again for joining, and I'm sure we'll speak to you soon.
Thank you so much, everybody.